the effects of the coronavirus on the world, etc. Just wanted to touch on the fact that you can really tell the messaging that's come out, especially in Australia, obviously being our experience, that you just don't see anyone around anymore. I can look out the window and it's you might see two people out there going through. I still actually have to go into work in the city, but there's barely anyone on the streets. I actually feel relatively safe there, relatively speaking, because there's literally no one around. Yeah, that's right. Where are the people, etc. There've been, I guess, as with anything, I think we mentioned, I just wanted to touch on it quickly, we mentioned that story about the NAB building being evacuated because of a COVID-19 diagnosis, and it turned out later on that staff member had falsified that, and they were summarily sacked, quite rightly, I think, and because of causing all that panic. And unfortunately, it just means all the team members in that team had to go undergo counselling, etc., because of the stress and whatever. And it just, that combined with a couple of other stupid examples of behaviour, the Bondi Beach thing. Then there was the thing here in Melbourne with St Kilda, people populating the beach yesterday, even as late as yesterday, and also that story of there was two other stories I read of people returning from the States. There was a couple that had attended a trip and had contracted in the States and then brought it back and then didn't self-isolate and then spread it to some other people. And then another one I was reading this morning about some medicos that came back from a trip in Chile that didn't follow the self-isolation demands of the border force when they came in, and they ended up having to chase them down because they were meant to stay at the airport hotel for 14 days. So a lot of craziness going around at the moment. But I think we were saying before we got on, though, that it seems like there's a sense, I think, that it's stabilising, like it's sinking in what's going on and what we all have to do.
Yeah, well, that's the good news. I think people are understanding the warnings, but it's really easy to drop your guard. It's really easy to forget. You see someone familiar or a friend or a family member, and you kind of think that it's, maybe you sit a little bit closer, and that's all it takes. Someone sneezes or wipes something on a common surface, and you get it. So the next couple of weeks, I guess we'll see just how well Australia has been heeding the warnings.
Yeah, and that's a tricky thing that I think everyone's coming to terms with, that they can put all these measures in, but it actually takes a couple of weeks to actually be able to tell if anything's happening.
That's right. And I think from that, what we'll see is that, you've got effectively from this a couple of weeks to work out, whether or not we have to go harder in Australia or whether or not we can just keep going with this high level restriction.
All right, I guess the question now turns out, like, there was an interesting discussion, or I guess that's being worked on at the moment by many, I guess, who are trying to figure out the best case scenarios with this and how to implement things or whatever. There was an article that I saw on the ABC site about the differences between what Australia's doing versus what New Zealand's doing, and it's the two countries are probably a good example of how to watch in terms of how this thing plays out, in the sense that Australia's doing the staged lockdown, whereas New Zealand's gone into full lockdown. And there doesn't seem to be a consensus of how or what or whether which one approach is best. And it may not necessarily be a one-size-fits-all anyway, because each country is having a different experience.
Yeah, well, I think the thing that where the two countries are similar is that they're both islands. And so by shutting down international travel, that's easy enough to stop the virus coming in. And then when you're looking at the spread of the virus, then New Zealand's got a North Island and a South Island. And so by going hard, you can contain it. The difference is Australia has got 6 islands on the mainland effectively, and we've closed all of our borders now. So we're predominantly in Australia as well, with probably the exception of New South Wales, well, probably the East Coast. We are very remote. New Zealand, certainly the North Island, is more like you would find in Europe, and probably you could argue that New South Wales, to a large extent, with the population concentrations, are similar in that it can spread literally through millions of people, whereas in South Australia, it's got 1 million people. or so. Tasmania, they've shut the borders. They don't have any cases, which has been very clever. They should be able to keep it out. But New Zealand has gone hard. There's no doubt about that. But the reality might be that they still have to have restrictions as long as we do anyway. I think it's a faint hope that just by going hard you can really defeat it, because if you come out too early, all it takes is one case and you'll be back here again in 3 months.
And that's the thing, the old flare-up issue, which may happen regardless of what ends up happening, because you just don't know what's being contained.
Well, the one thing that I had this conversation during the week, and basically the end game, we know what it is. So you need 2 to 3 weeks of no new cases, and then you add 2 to 3 weeks on top of that afterwards. So before you're clear, pardon me, it's not the virus. So effectively you're looking at 5 weeks to come out of this, whether you're hard or whether you're more moderate on your restrictions.
Yeah, absolutely. Just also wanted to touch on some overseas news. Obviously, there was the case of some high-profile people, Prince Charles and Boris Johnson, getting it, which kind of rams the point home, I guess. And I guess the irony being it was his health minister and chief medical officer that got it as well in the UK, as it happens. But apart from everyone's talked about how bad Italy is, and obviously it's quite bad there, but the States is where we're looking at in terms of how potentially bad it could get, because their case numbers are skyrocketing and it's not looking good, and it'll be interesting to see how they handle it.
Well, just as an observer, I can't really tell how bad it is in the States, except it's bad. I mean, there's no question about that, but a lot of the data we get is really sketchy. We hear about India going into a lockdown, and apparently they're very good at lockdowns because they experience, pandemics generally. I heard Indonesia was very bad about a week ago, but I haven't heard anything since. So at least with the US, we can see what's happening, but I really hope that they manage to get the numbers down. And we do know that once it really starts to skyrocket, the number of infections really take off, then the only way is total lockdown.